Nowadays, there are great discussion is going on between allopathic and Ayurvedic, all these things. But who is the father of the present allopathic medicine? We may say Hippocrates. Hippocrates is the father of allopathic medicine. Like that, Indian medicine that is called Ayurvedic system. These two medicines are maybe two systems of medicines defined health. Health is a state of body. Health is a state of body and mind where there was a balance between humors. Where there was a balance between certain humors. Humors ante what in a body fluids. So what are the fluids present in our body? That's a different criteria. Then afterwards, William Harvey, who identified or maybe who discovered blood circulation. He disproved the good humor, bad humor hypothesis projected by early doctors like Hippocrates, maybe Greek philosopher, or maybe Indian Ayurvedic system. He said the health is affected by so many factors. The factors may be genetic factors. They are by birth. Genetic fact deficiencies with which a child is born and the deficiencies or defects which the child inherits from parents at the time of birth. So it's not in our hands, the genetic makeup of the individual person. The next, you may have infections. Name itself indicating infections. It means coming out, infect by some other organism. It means mostly infective agents, like biological agents. We may use a word infective agents or infections. The next, we may have lifestyle. Lifestyle means taking the maybe intake of food or maybe water or maybe what we take the rest or exercise. All this comes under the category of lifestyle. Food. What type of food we are eating, whether you're using the balanced food or maybe eating the dumping the what you call carbohydrates only. So the balanced diet is one word we are using. That is a diet which consists of all essential nutrients. Essential nutrients may be carbohydrates or proteins or lipids or maybe vitamins and minerals. So these five, we may use a word essential, but the ratio is going to differ. You may require more carbohydrate because it's going to provide energy. But the proteins, other things you require less quantity. Okay. But they are essential. The development of immunity, the main things we may say proteins, minerals, and vitamins. Okay. The next question arises, what does health? What does health means? Simply, Bhavya say, I am not feeling well. Somebody say, I am suffering from fever. So, health does not simply mean absence of disease. Is it? Or physical fitness. Or physical fitness. Health is defined a state of complete physical, mental, and social well-being. Physical, we know very well. Mental, no one can't say. It's depending upon your individual mentality. maybe your surroundings, maybe your relatives, maybe your parents, maybe your friends. The mental health depends upon so many factors. And social well being, the society where we live, that also gives health, increase longevity of people, and reduces infant or maternal mortality. Of course, in the earlier days in our India, most of the people dies in the early stages. It's called infant mortality. Maybe children are going to die within 1 year, less than 1 year. That's why in the earlier days, some of the people say, I have given birth to 10 members, 12 members, but survival rate is maybe 1 or 2. And also, somebody ask your great grandfather, they say, I'm having 2 wives, 3 wives, because the maternal mortality is very high. At the time of delivery, they used to die. Once they died, again to look after the family, again they are going to marry, again dies, again like the 2, 3, 4, like that. But at present conditions, we don't have maternal mortality much, maybe negligence, and infant mortality also reduced. That itself a great achievement. Now see, life is going on smoothly. Suddenly, a big jolt entered. How it entered, what is the reason, that everyone knows. But it is giving the tremors. Recently, I saw some newspapers as well as the media. According to some estimations, Government of India announcing around 3 to the other countries, other people are estimating no, almost more than 50 to 60 lakhs of people died in India during this pandemic wave of corona, second wave. It's something is alarming. Why government is hindering the facts, we don't know. But still, people will say it is a medical mafia. People will say it is a corporate mafia. Whatever the reason. But whether it may be exaggeration 50 to 60, or maybe least number they said 3 to 4, both are incorrect, maybe. But the death cases in India, it is quite alarming. Maybe my age almost 59 years, going to complete within 15 days. But what I observed, the maximum death rate we are going to see. We have seen, but still we are going to see further and further. Maybe in the history, in the year 1910 and 20, during maybe the First World War or Second World War, whatever the reason, or maybe Spanish flu, somebody say, people died crores. In those days, we don't have much technology. We don't have much sophisticated medical technology. There is no pharmas in those days. Because the first antibiotic also not used, not discovered. So people may died crores. Maybe there's one estimation 3 to 4 crores of people are died because of Spanish flu. Maybe the world scenario, if you are able to take, it may be crossed, people are telling. I'm talking about India only 50, but in the entire global scenario, if you are going to consider, there may be a 3 to 4 crores of people died because of corona. Okay. Now, how to achieve good health? It's a good question. How to achieve a good health? Everyone knows what are the factors for good health. I don't want to discuss The factors itself, how to achieve also we can say. The first and first most awareness about the diseases and their effect on our different bodily functions. This is a good question. Awareness. Little bit difficult to explain what awareness we are having, because difficult to simply we know people are diseased, people are going to die. That only awareness. If people are going to die, how to prevent? We don't have much. Is why people are go to hospital and going to admitted and going to spend lakhs of rupees and finally their life. Then what is the but simply we'll say some problem is there, kidney function, we brain function, we say heart function, we'll say. But the second one, to achieve good health, vaccination is the one of the best method against infectious diseases. Vaccination. CBSE just announced all the children should be vaccinated. But government of Andhra Pradesh, till now they didn't allow below 45 for vaccination. But CBSE will say so many things, we'll see. Another most important one, proper disposal of the waste material. This big drive, maybe Prime Minister Modi, maybe I can't assess whether it's a fail or success. You'll see coming days. Proper disposal of the waste, Swachh Bharat, the drive he created among the people. The next, control of vectors. The next, maintenance of hygienic conditions. Maybe that is food, that may be food or water or maybe air, what you are breathing. Unfortunately, there is one more disease called black fungus, red fungus, something fungus, that. From where we got? Unhygienic conditions in the hospitals. Unhygienic condition. What do you mean by unhygienic here? It's not the outside unhygienic condition. Clinical unhygienic condition. Maybe the oxygen cylinder, maybe drinking water. Somewhere we got and it entering into the patients. You maybe wondered the black fungus or whatever the fungus, the mortality rate is very high. The corona may have mortality 3 to 4%, we say, but black fungus mortality rate comes around 50%. So, beware. Ultimately, we say, stay home, use mask, maintain safe distance. That's all. Sanitize frequently. Now, what are the difference between the infectious and non-infectious diseases? That's a very simple question. Infectious and non-infectious.
Sir,
Those diseases are going to spread or transmit from one individual or from one person to another. One person means infected person to healthy person.
non-infectious.
It's called infectious diseases, also known as going to spread from the community. So we call as communicable diseases, mostly which are caused by pathogens. The pathogens may be a bacteria, or maybe a virus, or maybe a, what you call protozoa, or maybe some of the worms, helminths, all diseases. Because symptoms of the disease, mode of transmission, or maybe the what you call pathogen name, very, very essential. So how it is going to enter? The pathogen enter the small intestine through a contaminated food and water and migrate to other organs through our blood. There is a river of what is the river of? There is a red river in our body. There is nothing but blood circulation.
B.
The symptoms, particularly sustained high fever, the next weakness, the next abdominal pain or maybe stomach pain, constipation and headaches and loss of appetite. These may be some of the symptoms. Then sometimes in the acute perforations, intestine randraలు ఏర్పడతాయి and even leads to death in the earlier days. The typhoid is going to stay 21 days or maybe 25, 28 days like that. Of course, nowadays we have modern technology and the antibiotic ciprofloxacin is the one which is able to kill the microbes. In this context, how to detect this disease? There's a test is called Vidal test, and the name of the test also right. The next, there is a one story. Her name is called Mary Mallon, commonly we call as Typhoid Mary. As a cook and typical carrier, and who continued to spread the typhoid for several years through the food she prepared. Beware. That is the reason whenever I am entering into the kitchen, please show your hands. Please show your hands. Particularly, maybe Ganga Bhavani or maybe Satyanarayana or maybe X, Y, Z. If their hands are not good, may have small cracks, then maybe small wounds. They are the carriers of so many pathogens. Okay. The next is called pneumonia. You write like the pneumonia, common cold, as well as malaria, particularly malaria life history. Very, very essential because malaria is caused by a tiny protozoan, Plasmodium. But it has so many variants. Plasmodium vivax, Plasmodium malariae, and Plasmodium falciparum, different types of malaria. But out of all, Plasmodium falciparum causes the most serious, also known as malignant disease. It's very, very fatal. దాన్నే మనం brain malaria, cerebral malaria. Of course, the life history is very interesting. The life history of the malarial parasite completes in two individuals. That's why it is called digenic. There's a great doctor who's known as Ronald Ross, who lived in our Andhra Pradesh and discovered the life history of mosquito. What we are studying the life history of malaria parasite, the credit goes to a famous doctor, British doctor, Ronald Ross, who worked in Fever Hospital at Barkatpura. Okay. And he's a Nobel laureate. You may say, a doctor also can, yes. A doctor is also a scientist. There are so many doctors are. The present day doctors may not be like that. They are money-minded. Leave it. The plasmodium enters the human body as sporozoites. Remember, sporozoites, the infectious form, through the bite of infected female Anopheles mosquito. Female Anopheles mosquito, which is a vector for is transmitting this disease. Once the sporozoites initially multiply within the liver cells and then attach to RBC, resulting our red blood cells are going to rupture. The rupture of RBC associated release of a toxin is called hemozoin. This hemozoin is responsible for the symptoms that is called chill and high fever recurring every 3 to 4 days or maybe 2 days like that. When Anopheles mosquito bites an infected person, these parasites enter the mosquito body and multiply to form as sporozoites that they are stored in the salivary glands of mosquito. Again, when these mosquitoes bite another human, then the sporozoites are introduced into the body. The malaria parasites require two hosts, that is human and a mosquito, to complete its life cycle. Now see, the diagram we have given plenty of information. The first diagram shows, because this is the question we are going to ask based on diagrams. They may mention this diagram, but you have to write A, B, C. This is the first step. When mosquito bites the another human of sporozoites injected with the bite. The second step, you see, the sporozoites reach to the liver. The parasites reach the liver through the blood. The third step is see, in the liver itself, the parasites reproduce asexually, the liver cells bursting the cells and releasing into the blood. Now, the parasites are going to, what you call, multiply in the RBC. RBCs are going to be ruptured and going to release the, what you call, hemozoin. Then afterwards, they may form as the gametocytes. The sexual cycle starts. The gametocytes, male and female gametocytes are there. Once again, mosquito comes and bites, the gametocytes enters into the mosquito body. The female mosquito take up the gametocyte, the blood meal. Then afterward, fertilization takes place in the mosquito, intestine of the mosquito. Now, zygote is formed. The zygote again going to divide and redivide, going to produce the sporozoites. This is the one. Asexual method of reproduction occurs in the human body. The sexual reproduction, what you call fertilization, fusion of gametocytes, occurs in the mosquito body. So then again, when sporozoites are ready, it enters. This is the life cycle of the mosquito. Is it mosquito or malarial parasite? Huh? The life cycle of malarial parasite, idiots. Called no other. Afterwards, the remaining things very simple. Read it. Just before exam, it is just observed within 2 minutes. Over. The most important one, everyone talking, immunity. Our thought. The overall ability of the host body to fight the disease causing organism, maybe pathogens or maybe allergens. You may call a term, that phenomena is called immunity, the natural resistance. How many types of immunity? The one is called innate, ante inborn, body lopala. Of course, entire immunity is there inside the body only. But innate means inborn immunity. The second type of immunity is called acquired immunity. If you don't have, you have to acquire from outside. That may be through vaccination, other things you may say. Now, innate. You see, the human beings are one of the organisms in this nature who is having a great immunity. That some are non-specific type of defense which an adult individual is born. When an individual is born, it consists of mainly four types: physical barriers, particularly skin. You have your skin, then you have your mucus, the mucous epithelium of respiratory system, as well as gastrointestinal and urinary tracts. The mucus plays very vital role. The skin prevents the entry of microbes, while mucus-coated epithelial cells traps the microbe and preventing entry into the inner cells. Besides that, you may have what we call as the saliva. The physiological barriers. These barriers include acids in our stomach, it's hydrochloric acid, and saliva in the mouth, tears from eyes that prevent the microbial growth. Besides the cellular barriers, we have so many type of cells. They are called the barriers in specialized cells, which have the ability to destroy phagocytes and destroy microbes. One is called WBC. We may use the word leukocytes of our body, like polymorphic nuclear leukocytes, commonly we call as neutrophils. EMNL milestone. Second, you may have monocytes. Third, you may have killer cells, natural killer cells. That also you may have the lymphocytes. Then finally, you can say amoeboid cells like macrophages. All are going to engulfing. They will try maximum level. They are all are called cellular barriers. The next, cytokine barriers. It means these include interferon, a specialized proteins secreted by the virus-infected cells. You see, once virus infect a cell, the cell is going to secrete a protein which protect the non-infected cells from viral infection. Commonly we call as interferons. You can ask a question, sir, when corona enters, it may be infect some cell, they may secrete a, yes, that only we may use a word, herd immunity. Of course, it may take some time. In the meantime, so many people will die. Even though without vaccination, maybe somebody attacked with the virus and afterwards they may be survived. Like antibiotic, it is your immune system protected yours, and finally they killed, they deactivated the virus, and your body developed antibodies against coronavirus. Those are able to develop, they are warriors, they are unable to develop, and the virus may be dominant. You may lose your fight. It's a battle. In this battle, somebody wins, somebody loses. The one who is having the less immune power going to lose the battle. That's all. It's not the age. 94 or 100 years old people also survived, but a 30 or 40 years old people are unable to survive. So, maybe we may say God's mercy. No, our body's ability. Okay. Now, the second type of immunity is called acquired. The first innate immunity is the responsible. The first wave people are survived because of the innate immunity. Now the second wave people we are giving the acquired. That's only we may say vaccination. It is a pathogen specific immunity. pathogen specific, is acquired by person during his or her lifetime, either contracting the disease or by vaccination. Contracting by disease. Vaccination. Again, myself, I have taken vaccine also. When our body encounters a pathogen for the first time, produces response. Maybe small response. This is called primary response, which is of low intensity. Again, we are going to use second dose and no. When we injected first dose of vaccine, body started fighting against that pathogen, and your response may be less. The second dose again we have given, body produced more, that we call as the second response. That's why we say subsequent encounter the same pathogen produces highly intensified response. That is called what we call as the secondary response, because the immune system has the memory of the first encounter. See, that's why what we say, vaccinate the people as early as possible. Of course, you may heard about so many countries, they completed 40%, 50%. Note down this one. What is the population of their country? Maybe you say Spain or Italy, France or England or Germany, something will say. They complete 40% vaccination. But no country in the Europe has more than 8 crores population. That Andhra Pradesh itself have 8 crores population. But country like India, we are having almost 135 crores of people. Then vaccination needs lot of time. Even though we are the only country who vaccinated more than 22 crores of people. Maybe US is there. They also around some 20. By the end of June, we may complete 33 or 32 crores. And we are putting our efforts, our governments are putting efforts. By the end of August, we are able to produce early. If it's possible or not, we'll see. But this month, we are going to supply 12 crores of vaccine doses. And at the end of June, it may be around 30 to 34 crores of people vaccinated. Maybe 1/4 population. So it's a great achievement, we can say, but we'll say, because most of the people are going to die, we may so many things we'll say. Production of vaccine, it takes time. We are all our biological students, we know very well. Okay, now the primary and secondary responses are carried out with the help of the two specialized cells. They are called B lymphocytes and T lymphocytes. What do you mean by B lymphocytes and T lymphocytes? The lymphocytes which are matured in the bone marrow, we call as B lymphocytes. There are some lymphocytes which are going to mature thymus region. That's why they're called T lymphocytes. Unfortunately, the thymus gland is going to disappear at the age of 20s. You people have more T lymphocytes than us. You don't have the thymus gland, all disappeared. Because when you are exposed to early situation, the B lymphocytes produce specialized proteins called antibodies in response to pathogen to find to fight with them. The T lymphocytes help the B lymphocyte to produce more and more antibodies. That's the reason why both T lymphocytes and B lymphocytes are essential. These antibodies are found once they produce, where they found in the blood and lymph. Hence, their production is called humoral immune response. Humoral immune response. And this type of immunity is called antibody mediated immunity. Antibody mediated immunity. Now, T lymphocytes produce cell-mediated response at this, and this type of immunity is called cell-mediated because T lymphocytes are going to help to produce more B cells or maybe more antibodies. So simply we can say T lymphocyte immunity is called cell-mediated, B lymphocytes we may say antibodies mediated. Okay, maybe now see, what is the difference between the antibody-mediated immunity and cell-mediated immunity? It consists of antibodies, cell-mediated, antibody-mediated. It defends the body against the viruses and bacteria. It does not respond to organ transplants. But you see, the cell-mediated consists of lymphocytes, maybe T lymphocytes and B lymphocytes, which are going to encounter the antigens and produce more and more antibodies. It means cell-mediated is the base for antibody-mediated. It defends the body against all pathogens, including fungi and protozoans. But antibodies which are produced only against the virus and bacteria. And it reacts against the organ transplants also. So, a person who is having the both type of immunities, then he is the victorious. Now, I'm not going to discuss about the antibody structure, the diagram, how to practice. Different types of antibodies are there, immunoglobulin A, M, E, G, like that. Okay, Nana? Then you may have active immunity, passive immunity. Active, it develops when person's own cells produce antibody. Vaccine నేను తీసుకున్నాను నా బాడీలో యాంటీబాడీస్ ప్రొడక్షన్ ఇస్ కాల్డ్ యాక్టివ్. అలా కాకుండా I produce the antibodies and my antibodies are transferred to another patient. దాన్ని ప్లాస్మా థెరపీ అని చెప్పాం. అది passive. It is conferred when ready-made antibodies are injected into the body. Provides immediate protection against the pathogen. For example, a snake bite. A snake bite you're giving the antivenom. It is called passive immunity. The colostrum, you know very well. The mother after delivery going to secrete the milk early. This is called colostrum. The initial days of lactation contains antibodies, mainly immunoglobulin A. Provides passive immunity to infant. That is the first antibody which enters to the baby through mother's milk. The fetus receiving some antibodies from their mother through placenta also. What is that name? Immunoglobulin G. Immunoglobulin G. To the milk, it is A. Then afterwards, vaccinations, other things quite common. What do you call the vaccination, immunization, passive and active. Then you may have the active autoimmunity, lymphoid organs. So if you're talking about immune system, the main function of immune system are to recognize foreign antigens in response to these and keep a memory of them. It also plays a role of allergic reaction, autoimmune diseases, organ transplantation. Now, then we may have different types of organ, lymphoid organ. What do you mean by lymphoid? Where maturation, where maybe origin and maturation and proliferation of lymphocytes takes place. Those organs are called lymphoid organ, bone marrow and thymus. So again, we are going to divide lymphoid organs are two types: primary lymphoid and secondary lymphoid. The primary lymphoids are nothing but bone marrow and thymus. These lymphoid organs were the immature lymphocytes differentiates. What is mature? It is nothing but antigen sensitive lymphocytes. You may have millions of lymphocytes, but they are not specific, they are not trained. If they are trained, then you can say antigen sensitive. Some lymphocytes are specific to some antigens. Okay, the next secondary, maybe spleen or lymph nodes or tonsils or Peyer's patches or small intestine or appendix, or we commonly call as the secondary lymphoid organs. And here one tissue is there, lymphoid tissue, with the lining of major tracts, maybe respiratory or maybe digestive or urogenital, mainly these three systems. We call the mucus associated. The mucus, the physiological barriers, not physical barriers, what we call as the mucus coated epithelium cells. That one we call as the MALT, mucosal